Welcome back. In this section, we will be discussing pharmacological actions of neuromuscular blockers, their therapeutic uses, their adverse reactions, their drug interactions with other drugs, and their contraindications. Now we will be discussing pharmacological actions of neuromuscular blockers. Let's find out what these are. We have already discussed the pharmacological action of neuromuscular blockers on skeletal muscle. Let's find out what other systems are being affected. Cardiovascular system. There will be an histamine release. It's also affecting autonomic ganglia and some miscellaneous effects which we will be discussing later. What is the action of neuromuscular blocker at autonomic ganglia? D-tuberculin is blocking autonomic ganglia. Succinylcholine may stimulate autonomic ganglia. Newer agents here less ganglionic effects. Histamine release. D-tuberculin is releasing the histamine, which is in turn leading to bronchospasm, bronchial and salivary secretions. What are the cardiovascular system effects? What are the CVS effects? What is the effect of neuromuscular blockers on CVS? The first effect is hypertension. Tuberculin, metocurium, mevacurium and atracurium can produce hypertension due to release of histamine. The second effect is sinus bradycardia or junctional rhythm with succinylcholine. There is a tachycardia with pancurium and galamine can produce tachycardia due to inhibition of vagus nerve to the heart and to some extent by the release of noradrenaline. Miscellaneous effects. What are the miscellaneous effects? Depolarizing agent can cause increased potassium efflux in patients with burns, trauma, or denervation and leads to hyperkalemia. Why it's important? Because why is hyperkalemia dangerous? Hyperkalemia is a condition which can be dangerous. Why? Hyperkalemia with the use of succinylcholine is dangerous because it can lead to cardiac events including cardiac arrest leading to death. So what are the therapeutic uses of neuromuscular blockers? The first and the most important use is it is used in adjuvant in surgical anesthesia. You remember the slide in which we discussed the history? What was the title? From fun hunting in jungle to operation theater. So what's the purpose in operation theater? What is happening in operation theater? Surgeries are going on. So we are using neuromuscular blockers along with general anesthesia, along with different type of anesthesia to enhance its effect, to make the muscle relax. And in this way, when we are using a muscle relaxant along with an anesthetic agent, we can actually lower the dose of anesthetic agent and we can lessen the adverse effects of anesthetic agent. What are the other uses? In orthopedic procedures for alignment of fracture, we definitely need a nice muscle relaxant. To facilitate intubation, whenever we give a general anesthesia, we intubate the patient so that he can have a proper delivery of oxygen. So for the endotracheal intubation, what is used? A neuromuscular blocker, but which type? Short acting. So short acting usually succinylcholine is used because it's a short acting and it nicely. So majorly we use succinylcholine. What are the other effects? It's also used in electroshock treatment of psychiatric disorders. It can also be used in spastic disorders like tetanus, tetanus epilepticus. In tetanus there will be spasm of the muscle, so we have to relax the muscle, and as well as in status epilepticus. Now we will be discussing the adverse effects of neuromuscular blockers. we will be dividing it into again our two categories, which we divide according to their mechanism of action, and we will discuss the adverse effect separately. First category is non-depolarizing agent. Let's see what are its adverse effects. Hypoxia, respiratory paralysis, hypotension. We have discussed that for it is also pharmacologically acting on CVS. So it can cause hypotension, regurgitation of the gastric juice, paralysis of the esophageal sphincter, and skin rashes due to histamine release. We also discussed that it can lead to histamine release in the pharmacological action. Now we will be discussing the adverse effects of the other group, which is depolarizing agent. Let's see what their adverse effects are. Cardiac arrhythmias and cardiac arrest, particularly in patients with burn, major injuries, peritoneal infections, and renal failure due to hypothermia. So this means the patients, those are having any one of these conditions, avoid using depolarizing agents in those patients, as they can lead to cardiac arrhythmias and cardiac arrest. Muscle pain and succinylcholine apnea may occur in some patients due to pseudocholinesterase genetic polymorphism. What is succinylcholine apnea? Succinylcholine apnea occurs when a patient has been given the muscle relaxant succinylcholine but does not have the enzyme to metabolize it. What this condition is, this pseudocholinesterase genetic polymorphism. In this condition, there is lack of that enzyme which destroy that. So we are not having that enzyme, so there is no metabolism of succinylcholine. Thus, they remain paralyzed for increased length of time and cannot breathe adequately at the end of an anesthetic. So this will lead to succinylcholine apnea. So we must rule out this condition. When used with halothane, succinylcholine may produce malignant hypothermia. What are the adverse effects on eye? Succinylcholine can increase intraocular pressure, which can interfere with the surgery on the anterior chamber of eye. So avoid using succinylcholine in the surgeries of eye. What are the adverse effects on GIT, your gastrointestinal system? Intragastric pressure can be increased with succinylcholine, causing vomiting and aspiration of the gastric content into the respiratory tract, leading to aspiration pneumonia. So whenever you are using a neuromuscular blocker along with an anesthetic, use a nice and strong antiemetic as well to avoid vomiting. Can cause pain and aches in the skeletal muscle. Now we will be discussing drug interactions. The first drug interaction is with cholinesterase inhibitor. Remember what is cholinesterase? We discussed it earlier. This was the enzyme which was degrading acetylcholine. When there is introduction of cholinesterase inhibitor, what will it do? It will not allow cholinesterase to degrade the acetylcholine. So this means in the presence of cholinesterase inhibitor, there will be excess of acetylcholine. And when there will be the excess of acetylcholine and there is a competitive antagonist, so it will compete with more of the acetylcholine, and acetylcholine has more chances of binding to the receptor site. So cholinesterase inhibitor is favoring the acetylcholine, so it will antagonize the effect of competitive type. It will antagonize the effect of competitive antagonist, and there will be more depolarization because there will be more of the acetylcholine. So this is how this drug interaction between cholinesterase inhibitor and competitive type of neuromuscular blocker happens. The second drug interaction is between an inhalational anesthetic and neuromuscular blockers. Inhalational anesthetics are enflurane, desflurane, isoflurane, and halothane. And when they are used combinedly, there will be a synergism. There will be a synergistic effect. When Neuromuscular blockers are used with aminoglycoside antibiotics. Again, there will be a synergistic effect. And when neuromuscular blockers are used with calcium channel blockers, again there will be a synergistic effect. So neuromuscular blockers are giving synergistic effect with three drugs. Those are calcium channel blockers, aminoglycoside antibiotics, and the third one is inhalational anesthetics. And this interaction with inhalational anesthetic is again favoring to lower the anesthetic drug. And the only the only drug interaction which we are studying here, which is antagonizing, is with cholinesterase inhibitors, else are synergistic. What are the contraindications of neuromuscular blockers? The first contraindication is myasthenia gravis. The second is hypersensitivity. Third one is succinylcholine should be avoided with halothane in burns, major injuries, renal failure, peritoneal infection, in patients with abnormal pseudocholinesterases. All the adverse effects we have discussed before, we should avoid using succinylcholine in these conditions. Galamine should be avoided during pregnancy and labor. A special mention here is Dibukane number. Dibukane is a local anesthetic administered intravenously. It is capable of inhibiting plasma cholinesterase enzyme, also known as butyryl cholinesterase enzyme. What is Dibukane number? The Dibukane number is used to differentiate individuals who have substitutional mutation of butyryl cholinesterase enzyme, resulting in decreased enzyme function. Why this is important with neuromuscular blocking agents? This enzyme deficiency can prolong succinylcholine and mivacurium neuromuscular blockade. What are the effects of age on neuromuscular blockers? In old age, effect of non-depolarizing drug increase. So what we are supposed to do? Reduction of dose is required in old age. With this, we are done with neuromuscular blockers. I hope I have covered all the aspects of neuromuscular blockers. Now you have to study this topic from your textbook. You must know the basic concept, what this drug is, what is its mechanism of action, and why we are studying this drug, and what are its therapeutic uses. Thank you. Stay home, stay safe.